Our next speaker, Rita Carreón, is Vice President for Health at Unidos US, a national Hispanic civil rights and advocacy organization based in Washington, D.C. Ms. Carreón oversees the organization's strategic direction in health, including community engagement and programming, addressing the social determinants of health, and advancing health equity. She currently leads a team on the public health response for COVID-19 through Unidos US's Esperanza Hope for All campaign. Ms. Carreón's expertise and interests include improving health and the quality of care for diverse communities. Ms. Carreón?
Actually, thank you so much for inviting me at this table and for Bobby Watts' leadership on for healthcare for the homeless work. I think a lot of the efforts that he's been leading ring true in terms of where our communities are at and how important it is for us to tailor our approaches in reaching out to the most needed populations. And so I'm happy to be here today. My focus today will be on moving toward health equity in the Latino community. For those of you who remember us, Unidos US was formerly the National Council of La Raza. It's the nation's largest Latino civil rights and advocacy organization. You know, our purpose for why we exist is we want to create a world where there are no barriers for Latinos to reach their fullest potential. And we really, our vision is to see a stronger America where economically, politically, and social advancement is really a reality for all Latinos. And so we want to make sure that Latinos thrive and are continuing to be contributors and to this country, and that those contributions are recognized. So I wanted to start with, our network of community-based organizations. We have nearly 300 community-based organizations. These are nonprofit direct service providers across all the states, including federally qualified health centers that Bobby Watts talked about, in addition to community development organizations, charter schools, and community-based organizations. This also includes organizations or subnetwork of subnetworks of individuals that stem really deeply into specific areas. Unidos US not only focuses on health, but we also focus on education, economic empowerment, housing, workforce development, immigration, and civic engagement. So we lean on our promotores de salud, our padres comprometidos, which are our parents who are leaders and ambassadors at the schools. We have a National Institute of Latino School Leaders. We have housing counselors. We're probably one of the biggest call centers in terms of helping Latinos get into homes. And we also have financial coaches, in addition to all the work that we did, a year ago with trying to get our Latinos to register to vote and be engaged through our canvassers. So one of the things that I wanted to talk about today was, before the pandemic, and even in terms of our key priorities of where we stand as an organization and the component that we work on is really, ensuring that, we're shaping a public narrative that's positive about Latinos. We want to make sure that the leaders that we work with and the advocates that we work with have the skills base to continue to lead within their communities that we know where health happens, really. We know that in our community, when you're serving an individual, you're serving their full self as well as their family. So a lot of our initiatives are focused around critical programs where we address the social determinants of health. We also want to create, and share actionable knowledge. We believe data is important for us to be able to support and provide resources in the communities that is needed the most. And, of course, meaningful and actionable access to, quality, equitable healthcare is front and center for us. I think Latinos in general have, with the ACA, have improved in terms of having more access to health insurance, but we have seen within the pandemic that we've also seen folks come off of it for a number of reasons. So I wanted to kind of pull us back a little bit, just because, we've been in this space for a while. You know, we have 50 years of experience as a civil rights or an advocacy organization. You know, back in 2016, we had done kind of an assessment of our affiliates to kind of, you know, further understand where their current needs were at. And this was pre-pandemic, right? And as you can see, you know, access to job and economic opportunities and having affordable food and affordable housing were just as critical for many of them. And I just wanted to bring this up because I know it's a little bit old, but it just kind of rings a little bit true in terms of kind of where we are today. And so the factors in terms of where Latinos access our healthcare system and impact their well-being of their children and their families is still affordability. It's still coverage. It's still preventive services. It's having a workforce that understands their needs, their cultural, dynamics, as well as, in language or language appropriate care. And this is just as critical for us. You know, if I were to now do an assessment of our affiliates, now post or in the current pandemic, you will see some of these things probably change across the notion based on what we've been hearing. But I did want to note that before the pandemic and in many of our world and what we were already dealing with was really these anti-immigration policies that created a major fear among Latinos, very anti-immigrant, anti-families that started to and seeing in many in terms of how we were accessing health care, education, our employment, in terms of discrimination, safety and violence within our communities, having a living wage, affordable housing, and food access, and being able to have access to food and be able to navigate, any social support services. And because of why I put immigration policy in the middle in terms of the fear is that we were starting to see many of our communities come off services that they were eligible for because of fear that folks would be penalized. And so this was something that we were working with and dealing with in trying to kind of elevate and protect our families and defend our families. So, back a year ago, the pandemic, as we all know, and have seen that, and how Sheree had mentioned that, it has impacted our communities at an extraordinary event. We're 60.6 million Latinos in this country. We make up about 18% of the population, but we were seeing, and we weren't surprised about this, that the cases of COVID cases, were extraordinary in terms of, our exposure to COVID, but also the deaths that are happening. And even at one point, we were seeing a lot of our kids, getting COVID because many of them were largely in homes where we had essential workers that were going and still going to work to make a living, to be able to continue to run this country economically and make sure that we all had food at the tables. So, one of the things that we focused on this year is to really try to increase access to vaccine and understanding about COVID through our public health response and through our Esperanza Hope for All. And we saw through, a poll that we had done with the COVID Collaborative and the NIHCM was that 34% of Latinos, have limited trust in terms of the vaccine being safe. And, 86% of them did not want to receive the vaccine as soon as possible. So we got to work. We knew, we spent the number of months in really trying to advocate the importance of data and data collection across states and with the federal government and how important it was. Back in March of this year, we actually did another poll with our healthcare voters based on an October poll that we had done last year to really try to get a sense of where people were at in terms of COVID with Univision. This was with 2,200 Latinos, both Spanish and English speakers, and in emerging communities where they're often not approached. And while we started hearing from our communities that they were cautious about reopening, in terms because they wanted to put health first over their finances, and it's largely because of just the number of losses that they were seeing. But that we still had a huge amount of Latinos that were hesitant about the vaccine, misinformation that was undermining our efforts, and really the huge economic consequences, not only in the loss of jobs, but health insurance and closed businesses, and really trouble keeping food on the table. So Unidos US launched, about a year ago, we launched our Esperanza Hope campaign, and then this year we expanded our Esperanza Hope for All campaign with a major focus on vaccines. But I want to reiterate that our Esperanza Hope for All effort is not just vaccine related. It's really looking at and mitigating the impact that the health, economic, and educational impact that this pandemic has played on Latinos. It's ensuring not only the delivery in terms of access to the different vaccines, but continuing the prevention, education, and testing efforts. Economically, it's really preserving Latino families' housing for renters and owners and preventing loss of home equity. And on the education side, is really mitigating the learning loss that we were seeing and continue to see among our children who have had to do remote schooling. In this next slide, what I provide here is a little bit about how we're approaching this year in terms of really reaching out to 20 million Latinos on public health information, trying to increase that confidence and awareness and education about the importance of, how to take care of yourself and why the vaccines are safe and ethical. But at the same time, one of the things that we are focused on is also on nutrition. It's coupled with our work that we're doing on increasing coverage, some special coverage, open enrollment, until the 15th with our communities, because many of them have lost jobs, so then they qualify for getting, and accessing health insurance. But on the economic and education side, it just shows to you that, we've been both on the policy and the programmatic work advocating for fair housing, for making sure that folks are not getting, their rights are protected. And Bobby Watts mentioned a bit about how the CDC, I think in my lifetime, had put that parameter in place in terms of evictions and stuff. And so, but on the education side for our children, I think it continues to be a big issue, not only on them learning, but also their mental well-being. So when we think about how we move forward in equity and what does it look like for the next generation of our children and our future, I would recommend mental health as a critical priority and social and emotional well-being of our kids. So the next slide just talks a little bit about kind of our, what we're calling our air game and our ground game on our campaign. We've been working in very multi-pronged effort across the campaign. And the reason why I lift up the vaccine campaign here today is because there isn't a one-size-fits-all. If you're looking to work with the Latino community, there are a number of different ways to do that. And it's on both on the national lens, but also on, in the local capacity of our affiliates. I think many of our affiliates we saw early on that had to close their doors, and others that kept open because they had a huge amount of community coming and knocking the doors and trying to figure out what had just happened and how they need some cash assistance to pay the rent or be able to, get tested or support in any other ways. And so we have launched, and we raised, I think $1.5 million last year to try to support our affiliates just for their own operations to have their technology in play. This year, a lot of our focus is working with a sub-network of our affiliates, both health centers and community-based organizations to, train local trusted messengers to make sure that they're knocking on doors and doing the outreach and education around the vaccines and hosting vaccination events. But it does take a lot. It's a lot of resources, a lot of workforce and training and data collection to be able to do some of this work. So the other, kind of air game that I wanted to mention is, the different initiatives that we have. For us, we see the importance of being on the ground, being able to do a mobile marketing tour or educational tour to make sure that we are in neighborhoods where some of these resources are not being brought. And even to this day, we hear that some of this information is not provided in the language that they speak. And so our partnerships with different agencies, with our affiliates, with corporate America, I think is critical for us to be able to do this together, to be able to get out of this pandemic, be able to go back to the lives that we cherish the most. But we have a long way to go in terms of major mis and disinformation that is happening across our country, and utilizing influencers to be able to support some of that work. So this is not done alone. We have multiple partners that we've partnered with, coalitions that we're part of, foundations that have supported us along the way in thinking about how we're addressing COVID, how we're addressing the vaccine access, and we'll continue to do that. But what I do want to mention is that, the vast majority of Latinos, so this one, right before I say that, we are starting to turn the corner. I think that, I mentioned, yesterday when we were releasing a new video from called The Conversation or La Conversación, which are a series of short bits of Latino doctors, nurses, promotoras to talk about the frequently asked questions. We also recognize that we are turning this corner, that we're hopeful every day, that hope is on the horizon, that Latinos want to get the vaccine. They just need to know where to get it and how to get it, and that not other things are limiting their ability to be able to receive the vaccine. So one of the things that I bring this up largely because, if you place some of these barriers that keep coming up in terms of your immigration status or your insurance status or your income or the lack of ability of having paid leave to go and get a vaccine or recover from if you are feeling sick from it. These are things that are structural barriers, that have been around for a number of years in terms of just how we think about the policies, the practice, the systemic racism that has occurred, and how we think about how we as our healthcare system is established and fragmented in the same boat, and how when we think about our communities, we've got to think much more broader, beyond the doctor's office and where people are coming from in terms of their own experiences and ability to get treatment and care. So we do need to recognize our blind spots. But I do want to, mention, the time that I have today with you all, is just a little, poquito, what do you say, a point that I can be able to just a nugget of information. I would encourage you to go to our website at unidosus.org. We have a number of different publications that we've recently pushed out. One was the 100 First Days of the Biden administration in terms of our priorities going forward, that we need to have equitable implementation of all the resources that are being put in place, equitable representation, meaning we have our Proyecto 20, which is a 1 year long, to make sure that Latinos are represented in this administration and across different angles, and racial equity. And we do have a paper that we released this last month, or I think in April, around racial equity and how you approach some of that work and really trying to level the playing field. And, I think for us, having, those that live in poverty, those are imprisoned, those that receive low quality education or unemployed or poor, can lead to poor health outcomes. And for our communities, we need to start building a better world for us for tomorrow. And so I think a lot of the times folks forget that Latinos have been contributors to this country. The vast majority of Latinos in the United States are American citizens. About 79% of Latinos living in this country are U.S. citizens, and are even our children. I think it's 1 in 3, children that are in schools are Latino, and the majority of them, 90% of them, are U.S. citizens. So I think we're a very heterogeneous population. Ensure that, when you meet one community, you have one community, and so those needs may change in how you approach it. So my next and last slide is just to, how do you lean in? How do you think about working with, our Latino-led community-based organizations, or even the community-based organizations that are in a large Latino community or a diverse community? My first and foremost ask of you is to listen. Listen and hear them out in terms of how do you amplify some systemic changes in policies and practice. What can you do as an organization and as an investor, as a partner, to invest in those communities, invest in language trusted messengers, or utilize, a multi-stakeholder approach. There isn't one size fits all, but we all have a stake in being able to elevate our voices, enhance the role of our local leaders because they have lived these experiences. The role of community health workers or promotores are significant. They have experienced some of this work for a number of years, and during this pandemic, hold them close, center your children as well in regards to family in our approach. So I guess at the end of the day, I'm saying be flexible, be bold, be collaborative, and disregard any potential ideas that you have of Latinos, but more of embracing a culture that has been a contributor to this country. So with that, Cherie, I'm happy to send it back to you and answer any questions.
Thank you so much, Ms. Carreón, for that great analysis of the complexity and of helping and improving health in Latino communities.